Hi, my name is Jordan Bauman, and our group members are Tom Stoll, Greta Ameng, and Annie Reyes, and today we'll be presenting on necrotizing fasciitis. So necrotizing fasciitis is caused by three main bacterium: polymicrobial bacterium, Streptococcus pyogenes, and Clostridial myonecrosis, which is also known as gas gangrene. These bacterium can be aerobic, anaerobic, or mixed flora. Necrotizing fasciitis is mainly caused by the bacteria Streptococcus pyogenes. It's mostly known for causing strep throat, toxic shock, rheumatic fever, cellulitis, and of course, necrotizing fasciitis. This group is referred to as A. streptococcus. It's gram-positive, and based on the name, you can tell the morphology is cockeye with a chain-like arrangement. And since it's gram-positive, as you can see in the picture, it's purple, and it does show that cockeye chain-like arrangement. It's considered to be a facultative anaerobic bacterium, which means it can grow in the presence or absence of oxygen. It's a non-motile bacterium, and there are no spores on this microbe as well. So around the cell wall is a thick capsule composed of hyaluronic acid. The cell walls have a high content of peptidoglycan and C polysaccharides that give it an extra strong structure. It is beta hemolytic, so it breaks down red blood cells. An easy way to tell if a microbe is Streptococcus pyogenes is to culture it on a blood agar. And if a clear ring shows around the microbes, then it shows that it's beta hemolytic, meaning that it has destroyed the red blood cells around it. And you can kind of see this in the picture on the screen, that it's been cultured on the blood agar, and around each of the microbes is that clear ring to show that it is beta hemolytic. This test, along with negative catalyst testing, can help you identify this microbe as Streptococcus pyogenes. So for reservoirs, humans are the primary reservoir for this bacterium for Streptococcus pyogenes, as well as polymicrobial bacterium, although cattle can also act as a reservoir as well. For Clostridial myonecrosis, gas gangrene, it can be found in soil, water, air, feces of healthy and infected individuals, dust, vegetation, gastrointestinal tracts of humans and animals, and a variety of dehydrated and processed foods. So even if your food has been dehydrated or processed, you get it from the store, if it was already contaminated, then you can still contract that Clostridial myonecrosis or gas gangrene. For mode of transmission, for Streptococcus pyogenes, it can be found in respiratory droplets, hand contact with nasal discharge, skin contact with sores or lesions. It can be found in its carrier state in the anus, vagina, skin, and pharynx, and contact with these surfaces as well. The bacteria can be spread to cattle and then back to humans. Though cattle do not contract the disease, they are carriers, so it can go back and forth between milk and things like that. Necrotizing fasciitis, it's usually caused by contamination through skin lesions and wounds that are infected. For Clostridial myonecrosis, it can also be contaminated or contracted through contaminated food, inadequately cooked or reheated meats, and we a lot of times hear about it in wars and things like that. Soldiers will get it through like shrapnel or soil that's been contaminated that gets in their wounds. For polymicrobial bacterium, it's transmitted the same way as the others, but it's usually found in seniors, those with autoimmune disorders, or those with low immune systems, or third world countries.
The history and the incidence of necrotizing fasciitis. We have first heard record of it from Hippocrates, who wrote something about necrotizing fasciitis as early as 5th century BC, and described it as erysipelas all over the body when the exciting cause was a trivial accident. Flesh, sinews, and bones fell away in large quantities. Erysipelas are an acute, sometimes recurrent disease caused by bacterial infection. It is characterized by large raised red patches on the skin, especially that of the face and legs, with fever and severe general illness. The disease has received many names following its discovery: phagedenic ulcer, phagedenic gangrenous, gangrenous ulcer, malignant ulcer, putrid ulcer, and hospital gangrene, which is a title that held for quite some time. Matter of fact, that's what it was known. That's how it was known during the Civil War, which is when the disease became much more regularly studied. The term was coined because these Civil War surgeons would do their job as best as they knew how and remove the limbs of injured soldiers. without sterile practice, of course, without sterile field, and this bacterial infection about which they knew nothing would set in. The surgical site would become gangrenous, become infected. They'd have to cut off more limb, and that would continue. With the hope that by getting ahead of the infection, you wouldn't get it again during the next surgery. It was during the 1860s, 1870s, there was a Confederate surgeon by the name of Joseph Jones who ended up studying this disease more thoroughly with about 2,500 infected patients, and discovered that the disease had about approximately a 50% mortality rate, 45-50% mortality rate, that ended up shifting our focus from the idea of managing this disease to trying to prevent it. Of course, not knowing about bacterial infection and sterile field for surgical practice, but that is when hospital gangrene ended up becoming under much greater scrutiny, and people started trying to negotiate it. In the 1950s, hospital gangrene was renamed as necrotizing fasciitis for obvious reasons. The bacterium, which predominantly Streptococcus bacterium, settles on the tissue fascia and spreads from there and kills the tissue it infects. Of course, right? We can infer from the name. Presently, it's become a term that's been used for. It's becoming more and more used for generic soft tissue, necrotizing soft tissue injuries. Regarding incidence, the incidence is much lower now than it was, of course, before we had sterile field surgery, which was the predominant cause of the infection, and the mortality of it has decreased greatly, as well as we've learned much more about not only prevention but recognizing signs and symptoms and treatment, as my colleagues go over. The last 10 years of data collected for the United States show nothing as far as suggesting that the disease is on the rise or the decline, but rather that the risk of developing necrotizing fasciitis is very low. It's something that can be very easily prevented. So with that, we'll move on to signs and symptoms and then treatment and prevention.
The skin is the body's first defense mechanism. Through surgeries, cuts, or abrasions, this creates openings in the body's tissue where bacteria can enter. During the normal healing process of wounds, as it heals, the pain diminishes. If a wound has been infected with any of the bacteria that causes necrotizing fasciitis, then within 24 hours, redness and swelling will develop at the site, along with an increase in pain sensitivity. The pain will then begin to spread. You will develop flu-like symptoms such as fever, chills, dizziness, and weakness. Weakness and fatigue is your body's way of letting you know something is wrong. If you are eating and sleeping well, and there is no other reason you would have low energy, then this means your body is putting all the energy it has into fighting an infection. Large violet-colored marks start to develop. This is a sign the disease is advancing. Eventually, these marks turn into blisters. Other skin discoloration will develop. If the tissue is black, it has become gangrene and is dead tissue. Necrosis is dead skin cells, and as they fall off, they leave behind large scars. As tissue is decomposing or dying, gas is formed from the bacteria eating the flesh. If you were to touch the skin around the site, you would feel a crackling sensation, like having Rice Krispies in your hand. Pus forms from dead white blood cells. This is a sign the body is trying to fight an infection. If the wound begins to have drainage, this is an indication that the body is losing the battle because too many white blood cells are dying. If someone hasn't received treatment by now, the body will develop sepsis, which can lead to septic shock. This is an indication it has become a systemic infection and the whole body is involved. Some of the signs and symptoms of septic shock are hypotension and rapid breathing. The rapid breathing is due to the body going into a metabolic acidosis. This acidosis is due to the buildup of the lactic acid. The kidneys are working very hard. This is to compensate for the hypotension and the metabolic acidosis. This is apparent by the decrease in urinary output. The person will eventually go into renal failure. Septic shock is a critical state and the condition is difficult to reverse. If it is not treated quickly, it can lead to death.
All right. So when it comes to the treatment of NF, or necrotizing fasciitis, it's very important that the patient acts fast because NF can spread rapidly. And if they wait too long, there could be such severe damage to the tissue that it's impossible to cure or save the part that is infected. So with that, when the patient enters the hospital, they most likely will receive an IV of antibiotics to try and help stop the infection and prevent it from spreading even more and destroying more tissue. Sadly, though, sometimes the antibiotics are not able to reach the infected areas because blood flow has been cut off or is not able to make it because the bacteria has killed so much tissue that it makes it impossible for blood flow to get there. When this happens, this will resort to surgical debridgement or surgical removal of the dead tissue. That way, the spread of bacteria cannot spread anymore, creating more tissue damage in other areas. And in some cases, the tissue damage is so severe that amputation is needed. This rarely does happen. It's just a handful of cases that it comes down to that. But mostly antibiotics and surgery are the two main types of treatment for NF, or the two main treatments of NF. Just a little side thing, if you are looking online for treatments of NF, you may come across something called hyperbaric oxygen therapy, which is just breathing pure oxygen in a room that is pressurized and is supposed to help preserve healthy tissue. It's still up in the air whether or not this can help NF, but research is being done on it. When it comes to prevention, there's no sure way to prevent NF, but there are many simple ways to reduce your risk of getting NF. And believe it or not, a lot of them are super simple. The first thing is to make sure that all cuts and injuries are clean. If the skin has been broken, the best thing to do is to make sure that you clean out your cuts with just soap and water. This can help prevent or help clean out any bacteria that's lurking in there. Another step is to clean and cover open wounds with a clear, dry bandage. It's important to make sure that the bandages are clean and dry because as your wound is healing, that bandage is the barrier to help keep the bacteria out of the wound. If you have a serious puncture wound, it's best just to go to the doctor to have it checked out. Even if you are cleaning it with soap and water, it still may not be enough to clean all the bacteria out, especially if it's a deep, severe wound. And your doctor can help you with that simply. Always wash your hands. Always wash your hands with soap and water. This should be on everybody's hygiene habits, but make sure that you do it often. And if you're out where nowhere to wash your hands, you can use hand sanitizer. This can help just keep your hands clean. Make sure that you take care of any fungal infections, such as athlete's foot. You can do that with a simple topical ointment, or if it's more severe, go to the doctor and they can help you out. And last, for prevention, just use common sense. If you have an open wound, try to avoid bodies of water, such as hot tubs, swimming pools, natural bodies, like lakes and rivers and hot springs. Swimming there with an open wound can increase your chances of NF.